Most people think cholesterol is the best warning sign of a heart attack, but doctors now know there are blood tests that can predict heart risk far earlier and far more accurately. One of these markers can reveal hidden inflammation in your arteries years before symptoms appear. Watch until the end, because these 3 tests could uncover a silent heart risk your regular cholesterol test completely misses. I'm Dr. Barbara, and today I want to talk about something that may surprise you. For decades, cholesterol has been considered the main number doctors look at when assessing heart attack risk. Many people believe that if their cholesterol is normal, their heart must be safe. But modern medical research has shown that the story is far more complex than that. In fact, many heart attacks happen in people whose cholesterol levels are considered normal. That's one of the reasons doctors and scientists have spent years studying other markers in the blood that may reveal danger earlier and more accurately. Your blood carries far more information about your heart than just cholesterol. Hidden within it are signals that can reveal inflammation in your arteries, stress on your blood vessels, and even tiny particles that directly contribute to plaque formation. These signals can appear years before a heart attack ever occurs. Today we're going to explore 3 powerful blood tests that many cardiologists now consider extremely valuable for predicting heart attack risk. These tests often reveal warning signs that traditional cholesterol tests can completely miss. The first marker we need to talk about is inflammation. Heart disease is no longer viewed simply as a problem of cholesterol building up in arteries. Modern medicine now recognizes that heart disease is also deeply connected to inflammation within the blood vessels. Think of inflammation as irritation inside the artery walls. When the inner lining of an artery becomes irritated, the body responds as it would to an injury. Immune cells rush to the area, chemical signals are released, and the body attempts to repair the damage. Over time, this process can lead to the formation of plaques, fatty deposits that narrow the arteries and restrict blood flow to the heart. But here's the critical point. Inflammation can exist long before cholesterol plaques become large enough to show up on scans or cause symptoms. One of the most powerful tests used to detect this hidden inflammation is called the high-sensitivity C-reactive protein test. This test measures a substance produced by the liver when inflammation is present anywhere in the body. When levels are elevated in the bloodstream, it may signal that inflammation is affecting the arteries and increasing the risk of plaque formation. What makes this test especially valuable is that it can detect very small increases in inflammation, far below the levels that older tests were able to identify. In other words, it acts like an early warning system. Someone might have cholesterol numbers that look perfectly normal on a routine blood panel, but if their C-reactive protein level is elevated, it may indicate that inflammation is quietly damaging the arteries. Studies have shown that people with higher levels of this marker may have a significantly increased risk of heart attack, even if their cholesterol appears well controlled. This discovery changed the way many doctors think about heart disease. Instead of focusing solely on cholesterol numbers, cardiologists began paying closer attention to the inflammatory processes happening inside blood vessels. Inflammation can be triggered by many factors. Chronic stress, poor diet, smoking, lack of physical activity, excess body weight, and certain metabolic conditions can all contribute to increased inflammatory activity in the body. Even conditions like gum disease or chronic infections may raise inflammation levels. When this inflammation affects the delicate inner lining of arteries, it can make those arteries more vulnerable to plaque buildup and rupture. A plaque rupture is one of the most dangerous events in heart disease. When a plaque breaks open, the body reacts by forming a clot at the site of the injury. If that clot blocks blood flow to the heart muscle, a heart attack can occur suddenly. This is why detecting inflammation early is so valuable. If doctors identify elevated inflammatory markers before serious plaque formation occurs, patients can often take steps to reduce their risk. Lifestyle changes such as improving diet, increasing physical activity, managing stress, and quitting smoking can significantly lower inflammation in many individuals. In some cases, medications may also be recommended to reduce both inflammation and cardiovascular risk. The important message here is that heart disease is not caused by a single factor. It is the result of multiple processes working together: cholesterol levels, inflammation, blood vessel health, genetics, and metabolic balance. Looking at only one number, such as cholesterol, may not reveal the full picture. That's why advanced blood tests have become an increasingly important part of modern heart risk evaluation. When doctors combine traditional cholesterol testing with markers of inflammation and other specialized measurements, they gain a much clearer understanding of a person's true cardiovascular risk. For many patients, this deeper insight can lead to earlier intervention and better prevention strategies. Your heart is an incredibly resilient organ, but it depends on healthy blood vessels to supply oxygen and nutrients every second of the day. The sooner potential problems are detected, the easier it becomes to protect that vital system. In the next part, we'll explore the second powerful blood marker that can reveal hidden heart attack risk, one that measures a specific particle in the blood that can damage arteries even when cholesterol levels appear normal. Understanding this test may completely change the way you think about heart health and prevention. As we continue, it's time to talk about the second blood marker that many doctors now consider critical for predicting heart attacks: lipoprotein A, often abbreviated as LPA. Unlike regular cholesterol tests, which measure LDL, HDL, and triglycerides, LPA is a special particle that circulates in the blood and can directly contribute to plaque formation and clotting. Here's the key: even if your LDL cholesterol is normal, elevated LPA can silently increase your risk of heart attack. This particle is somewhat inherited, meaning it's largely determined by genetics rather than lifestyle alone. Some people naturally have higher levels, putting them at greater risk even if they appear healthy and maintain a good diet. So why is LPA so dangerous? It's because this particle is highly atherogenic, which means it can stick to the walls of arteries and promote the development of plaques. Even small amounts of LPA can accelerate the buildup of fatty deposits over time, narrowing arteries and making them more vulnerable to rupture. When a plaque ruptures, a clot can form and suddenly a heart attack occurs, sometimes without warning. Unlike cholesterol, LPA levels are relatively stable over a person's lifetime, so a single test can provide meaningful insight into long-term risk. Doctors often recommend testing for LPA in adults with a family history of early heart disease or unexplained heart attacks, because elevated levels could explain why someone developed heart disease despite normal cholesterol. High LPA also interacts with other factors. For instance, if inflammation in the arteries is already present, LPA may act as a catalyst, making plaques more prone to rupture. This is one reason why combining tests like measuring both inflammation through C-reactive protein and LPA gives a far more accurate picture of heart attack risk than cholesterol alone. The good news is that awareness of elevated LPA allows for proactive management. While lifestyle changes have limited effect on LPA itself, doctors can focus on controlling other modifiable risk factors, keeping blood pressure in check, reducing LDL cholesterol, managing blood sugar, maintaining a healthy weight, and using medications if needed to protect the heart and blood vessels. The third blood test is less well known but equally powerful. It measures small, dense LDL particles. Traditional LDL cholesterol tests measure the total amount of LDL, but not all LDL is created equal. Small, dense LDL particles are far more likely to penetrate the arterial walls and trigger plaque formation than larger, fluffier LDL particles. Someone can have an acceptable LDL number but still carry a high proportion of small, dense LDL particles, and that's where hidden risk comes in. These small, dense particles are often linked with insulin resistance, metabolic syndrome, and high triglycerides. If you've been told your cholesterol is fine, but you have belly fat, high blood sugar, or elevated triglycerides, it's worth discussing testing for small, dense LDL with your doctor. It could reveal risk that standard cholesterol tests completely miss. Taken together, these three markers, C-reactive protein for inflammation, LPA for genetic plaque risk, and small dense LDL for particle quality, give a far more complete picture of heart health. They allow doctors to identify patients who might otherwise appear low risk but are actually vulnerable to a sudden heart attack. Early detection is powerful. Knowing your risk enables you and your doctor to take targeted action, whether that means lifestyle adjustments, medications, or more frequent monitoring. It also emphasizes that heart disease is not solely about cholesterol. It's about the complex interaction of genetics, inflammation, particle type, and overall cardiovascular health. If you think about it, your blood is like a roadmap of your arteries and heart. These specialized tests reveal hidden traffic jams and weak points before they cause a catastrophic event. Ignoring them is like driving blindly through an intersection full of unseen hazards. You might appear safe, but danger could be building quietly. In the next part, we'll discuss practical steps you can take if one or more of these tests indicate elevated risk. From diet and exercise to supplements and medications, understanding what works and what doesn't can dramatically reduce the likelihood of a heart attack, even if your traditional cholesterol numbers look perfect. Now that we've explored the three powerful blood tests, C-reactive protein for inflammation, LPA for genetic plaque risk, and small, dense LDL for particle quality, the question becomes, what can you do if one or more of these tests show elevated risk? The answer is that knowledge is your greatest tool. Once you know where your hidden vulnerabilities lie, you can take proactive steps to protect your heart before a catastrophic event occurs. The first step is lifestyle. Even when genetics play a role, habits have an enormous impact on how those risks manifest. A heart-healthy diet is foundational. Focus on whole foods rich in fiber, lean proteins, and healthy fats like olive oil, nuts, and fatty fish. Avoid processed foods high in sugar, refined grains, and trans fats, as these promote inflammation and small, dense LDL formation. Regular physical activity is another cornerstone. Even moderate exercise such as brisk walking, swimming, or light strength training improves blood flow, reduces inflammation, and helps maintain healthy cholesterol and triglyceride levels. It also supports weight management, which is closely linked to metabolic health and heart protection. Stress management should not be overlooked. Chronic stress elevates inflammatory markers in the blood and increases the workload on your heart. Simple daily practices like deep breathing, meditation, or even a short walk outdoors can dramatically reduce stress hormones and help your blood vessels stay flexible. For some individuals, supplements or medications may also be necessary. Statins, for example, are well known for lowering LDL cholesterol, but they can also reduce arterial inflammation. In cases of elevated LPA, your doctor may recommend specialized therapies or closer monitoring of cardiovascular health. Aspirin or other antiplatelet strategies may be considered in certain situations, but only under professional guidance, as the risks and benefits must be weighed individually. Regular monitoring is critical. Blood tests should not be a one-time check. By tracking your inflammatory markers, LPA, and LDL particle types over time, you can see how your lifestyle and medical interventions are affecting your heart risk. This proactive approach allows adjustments before problems escalate. Sleep is another underestimated factor. Poor sleep elevates inflammation and stress hormones, both of which can accelerate heart disease. Prioritize 7-8 hours of quality sleep nightly and maintain a consistent schedule to support heart and brain health. Hydration, while often overlooked, supports optimal blood viscosity and circulation. Proper fluid intake ensures that nutrients and oxygen are efficiently delivered to heart tissue and that waste products are removed effectively. Finally, never ignore family history. Knowing whether heart disease runs in your family can inform how aggressively you monitor these advanced blood markers. Even if traditional cholesterol levels appear normal, elevated LPA or persistent inflammation can indicate a higher inherited risk that deserves attention. The key takeaway is that heart health is multidimensional. Cholesterol alone cannot reveal the full story. By understanding inflammation, particle type, and genetic factors, you gain a far more accurate assessment of your true cardiovascular risk. And with early detection, combined with lifestyle, medical guidance, and monitoring, you can dramatically reduce the likelihood of a heart attack, even if your routine cholesterol tests look perfect. Your blood holds the map to your heart's future. These 3 tests give you early warning signs that could save your life. Don't wait for a heart attack to make you pay attention. Get tested, understand your results, and take action today to protect your most vital organ.